In 1824, Dr. David Long, Cleveland's first physician, founded the Academy of Medicine of Cleveland in Northern Ohio. At the Academy's first meeting, its 5 original members set out to establish and practice the highest quality of medicine and to educate the community. This remains an integral focus of the Academy's mission today.
The Academy of Medicine has a long history of advocacy and environmental health promotion for the city of Cleveland. So in 1911, there was a typhoid outbreak, and Academy physician members found that the source of the outbreak was coming from the water supply. And they were able to share this information with the city of Cleveland and then promote distillation of the water and filtration. This was able to effectively curb the outbreak.
In the early 1900s, we realized that infant mortality in Cleveland was particularly high, and our physicians wanted to figure out why. After doing some studying, they realized that the milk supply was not consistent in our region.
What the Academy of Medicine was able to do is they were able to promote the city to require pasteurization of milk, and they also provided free milk inspections.
The infant mortality rate significantly dropped, and we were able to see a real public health intervention very early on in Cleveland's history that would lead to saving more lives and keeping the population healthier.
The Academy of Medicine started a program where we had a 24-hour, 7 days a week emergency call line that people could call if they needed medical help, and the Academy staff would help arrange help going to their homes or help get them in to see physicians. And the first month, they had over 5,000 calls, and in the first 6 months, they had nearly 30,000 calls.
In the early 1930s, they were doing health exhibits. Unlike other medical museums, they wanted to tell people about the body in its most healthy form. They wanted to learn about how the body worked, and that over time became the Health Education Museum.
One of these ideas came out of the Great Lakes Exposition. We had what we called the Camp Transparent Woman, and she was a 3D figure of the inside anatomy of a human being. And we saw how interested the public was. And so it was that moment, I think, that our leaders thought, let's turn this into a whole museum so that children and adults in the community can learn more about health. In 1938, we worked with the Cleveland Hospital Association to put together really what was the first Red Cross blood drive. This is for the first time we're collecting blood from strangers to give to other strangers and really creating this immeasurably important resource for the healthcare community.
In 1952, in conjunction with the Health Museum, the Academy launched its award-winning television program, Prescription for Living. This really expanded their impact on community awareness.
So just take a moment. Will it hurt? No, you won't even feel it. I just want to get a little blood from your finger. Look the other way. What you going to do with that? Oh, we'll just look at it under the microscope. Then the doctor will be able to tell a lot of things about you, Freddie, that he wants to know.
And that's what we'll be talking about on this week's Prescription for Living, your life's blood, what it can tell a trained physician about you, and the primary diseases that may afflict the blood.
In 1957, Cleveland was seeing an outbreak of polio, and we had the injectable Salk vaccine. So the Academy was instrumental in making sure that nearly 150,000 children in the greater Cuyahoga County area were vaccinated against this disease.
In 1957, as people were buying more chemicals and bringing them into their homes, and there was an increased risk of children to ingest those chemicals, the Academy started a 24/7 poison control hotline, the first of its kind in the nation. Back in 1959, the AMCNO conducted a lead poisoning survey, which found that in Cleveland neighborhoods, 1 out of 17 children actually had elevated blood levels. And our work continues in this area. The AMCNO is a part of the Lead Safe Cleveland Coalition, as well as the Ohio Lead Free Kids Coalition.
Polio was becoming more and more of a problem in the late 1950s, and the Academy saw a need to expand vaccination. And so really what became our hallmark event was called Sabin Oral Sundays. It was named after Dr. Sabin, who had created the vaccine, which was put onto sugar cubes.
I remember getting together with my family. We all lined up on those 3 Sundays to get our sugar cube.
It was really a fantastic coordinated campaign with everyone in the city of Cleveland working together.
Dr. Sabin made a comment that it was one of the most efficient, if not the most efficient, vaccination program that existed in the country at the time.
One of the things we're also very proud of is the Academy of Medicine Education Foundation, and we've been giving scholarships to medical students since 1962.
The Academy has supported students in the area with over $1.8 million in scholarships.
We are passionate about medical education, and we are dedicated to try to make medical school more affordable.
In 1975, our own TV doctor, Academy past president Dr. Ted Costell, joined the WEWS news team to provide accurate health information to the public. The Academy has always prioritized access to health care. In 1983, we enlisted more than 1,400 physicians to serve the recently unemployed and their families, providing no-cost care to over 2,500 people. Academy past president Dr. Richard Fradian discussed the program with President Ronald Reagan at the White House.
In 1989, we started a program called the Mini Internship Program,
which basically combined all of the specialties in medicine and brought in leaders in business, education, practice of law, people in media, politicians, and had them come and spend 2 days with 4 physicians. It provided a great conduit between physicians and people in those walks of life, who then became sounding boards for us in terms of the communities that they served.
COVID-19 was obviously a challenge for the entire country, but particularly for the medical community. And if there's one theme throughout the Academy's history, it's that when things get tough, we run faster, not away.
Our members were out there volunteering in many different communities around Northeast Ohio, being part of the overall vaccine program.
There was a bill introduced in the Ohio House that would not require vaccinations for people who need to be vaccinated against COVID-19.
Through the Academy, I was able to go to Columbus and help to advocate against the anti-vaccine campaigns that were going on at the time. It was critically important, and had I not been a member of the Academy and the president at the time, never would have had that opportunity.
Vaccinations not only protect the immunized, but can also reduce disease among unimmunized individuals and the community through indirect effects or herd protection.
In 2023, AMCNO continued its public health impact by testifying to Cleveland City Council in support of a ban on flavored tobacco and e-cigarette sales.
We just are thrilled to be stewards of the Academy at this incredibly amazing moment of 200 years.